Okay, so today we are going to finish up section 4.3 and then also section 4.4. So on 4.3, we were talking about barriers to communication, and one is physical disabilities, which we talked about last time, and then also psychological barriers, which we also talked about last time. And then today we are going to talk about the cultural diversity, how that can create barriers. So culture consists of values, beliefs, attitudes, and customs shared by a group of people. It is usually passed on from one generation to the next and is often defined as a set of rules. It allows an individual to interpret the environment and actions of others and to behave appropriately. Some culture groups may have beliefs and practices regarding health and illness. Individuals from different cultures may have their own beliefs about the cause of an illness and the type of the treatment required. It's important to remember that individuals have the right to determine the treatment plan and even to refuse traditional treatments. At times, these individuals may accept traditional healthcare but add their own culture remedies to the treatment plan. So, some cultures may go with what the medical advice is from doctors, or some may tend not to go to the doctors as often, and they may look to their elders as to what they should do, or they may want to go with the more natural treatments. Language differences are another barrier to communication. In the U.S., English is the primary language used in healthcare. If a person has difficulty communicating in English and a healthcare worker is not fluent in another language, a barrier exists. So I had a patient once who spoke only Spanish, could not speak any English, worked on a big farm in the area, and he had a friend on the farm that could speak English but was not available, of course, because he was working to translate for us. And so when I went to see him, I used pictures and gestures and showed him what I wanted to do throughout the visit to see how he was doing. So I'd pull up pictures on my tablet and show it to him, and then he would usually show me what he was doing with that. So it worked pretty well. I think he was doing quite well. He didn't need further OT visits. And then in the end, um, I had him call his friend, and so he was on the phone, and I told him I had his friend interpret my thoughts on the visit and that the patient didn't need any further visits so that the patient knew what was going on when I left. But definitely, if you can use an interpreter, you definitely should use one. It'd be a lot easier, and you can get the information across that you need to. So in my case, it worked. But in other cases, like if you're trying to have the patient sign some paperwork or tell them about a surgery, then obviously pictures would not help. While providing care to people who have limited English speaking abilities, make sure you speak slowly, use simple words, use gestures or pictures to clarify the meaning of words, use nonverbal communication in the form of a smile or gentle touch, and avoid the tendency to speak louder, since this does not improve their comprehension. They're not hard of hearing, they just don't fully understand English. Whenever possible, try to find a translator who speaks the language of the patient, such as another healthcare worker, a consultant, or a family member. Many healthcare facilities provide written instructions or explanations in different languages to facilitate the communication process. This is definitely going to be the case if you are working at a very large hospital in which there are a lot of people in the area who English is not their primary language. Another example of communication barrier is eye contact. In some cultures, direct eye-to-eye contact while communicating is not acceptable. These cultures believe that looking down shows proper respect for another individual. So a healthcare worker believes eye contact is important, must learn to accept and respect this cultural difference in others, and accept that person's inability to engage in contact while communicating. So, for Americans, many times if you don't have eye contact, it means that you may either be shy, or you're not confident, or you're not listening. And other cultures, it is a form of respect of not meeting eye contact. Ways of dealing with terminal illness and severe disability is different among cultures also. In the U.S., a traditional healthcare belief is that people should be told the truth about their diagnosis and informed about the expected outcome. But in some culture groups believe that a person should not be told of a fatal diagnosis and be burdened with making decisions about treatment. So they withhold that from the patient. In these cultures, the family, the mother or father, or another designated individual are expected to make decisions about the care, treatment, information given to the patient. So it doesn't matter that the patient is an adult. Their parents or another family member would make the decisions for them and will decide how much information is given to that patient. When this occurs, it is important for healthcare workers to recognize this and to involve these individuals in the patient's care. It may be necessary for a patient to use legal means, such as a power of attorney, for healthcare to designate responsibility for their care to another person. Even touch can create a communication barrier. In some cultures, it is inappropriate to touch someone on the head. Other cultures have clearly defined areas of the body that can be touched or that should be avoided. Even a simple handshake can be regarded a lack of respect with some cultures. In some cultures, only family members should provide personal care. Healthcare workers should get permission from the patient before providing care and should avoid any use of touch that seems to be inappropriate for an individual. So if this is the case, you just like any time you provide treatment for a patient, you always ask permission. And if the patient is acting very worried or upset that you plan to do this, then you need to hold off and wait and see if there's somebody else in their family who can help you provide care. That is inappropriate. Respect for and acceptance of cultural diversity is essential for any healthcare worker. Beliefs, ideas, concepts, and ways of life that are different can lead to communication barriers. Make every attempt to learn about the cultural differences. Show respect for an individual's right to cultural beliefs. Reporting or recording all observations noted while providing care is an important part of effective communication. And this is by documentation. We talked about SOAP notes today. In the Zoom meeting, you must listen to what the patient is saying as well as make observations about the patient. All senses are used to make observations. The sense of sight can help note the color of skin, urine or stool, swelling or edema, presence of a rash or sore, amount of food eaten. The sense of smell alerts healthcare workers to body odor, unusual odors of breath, wounds, urine, or stool. So like a yeast infection, it usually has a yeasty smell. It smells like yeast. So that is something that you could document. Sense of touch is used to feel the pulse, note dryness or temperature of the skin, and to note perspiration and swelling. So let's say if you're trying to describe someone's urine, you might describe it as it is a dark yellow and has a strong foul smell to it. For their skin, is it cool and clammy to the touch, or is it dry? Is it moist? Is it cracked? Sense of hearing is used to listen to respirations and coughs, abnormal body sounds, speech. Using all senses, a healthcare worker can learn about a patient's condition and report observations accurately and in a complete and fully way so that when somebody reads their observations, they can understand what is being said. Observations should be reported promptly and accurately. Report to immediate supervisor when needed. Subjective observations are commonly called symptoms. They cannot be seen or felt. Usually statements or complaints made by the patient, and they must be reported in the exact words the patient used. Objective observations, commonly called signs, they can be seen or measured. Examples include a bruise, cut, rash, or swelling, and you may even document the size of the bruise or the cut or the swelling. Blood pressure and temperature is measurable, so that's an objective observation. Reporting an observation made Should not say, I think Mr. B has a fever. Instead, you should say, Mr. B is complaining of feeling hot. His skin is red and flushed, and his temperature is 102 degrees. So here's the SOAP notes, which we talked about in the Zoom meeting, and descriptions of each, and then also examples. Recorded observations on a patient's healthcare record must be accurate, concise, and complete. Writing should be neat and legible. Spelling and grammar should be correct. Only objective observations should be recorded. If a patient statement is recorded, the statement should be written in the patient's own words and put in quotations. So you don't give your opinion. You don't say patient is non-compliant with HEP because because it appears that he does not care about therapy. You do not know that. You don't know why he's non-compliant unless he tells you the reason why he's non-compliant. So you want to make sure you state the facts and not your opinions. Information should be signed with the name and title of the person recording it. And so my signature, it was, of course, my signature, and then it was OTR for Registered Occupational Therapist. Errors, we've talked about this before. Cross it out with one straight line, insert your correct information, initial it, date it, and you can write error. So HIPAA we talked a lot about in another chapter. So again, you need to make sure that you keep all patient information private and is only given to people who are on a need-to-know basis. And you can't just give it out to family members without having permission of the patient. Again, don't release any information unless you have permission from the patient, and do everything that you can to provide privacy and confidentiality of the patient's healthcare records. So good communication skills allow development of good interpersonal relationships. Patients feel accepted, believe that others have an interest and concern in them. They feel free to express their ideas and fears, especially when you have that good relationship with them. Develop confidence in healthcare workers. They believe they are receiving quality healthcare. So a healthcare worker also relates more effectively, must also be able to relate effectively with coworkers and individuals. So not only with our patients, but our coworkers, and then also with family members. Interpersonal relationships is section 4.4. It's a major factor in any individual's life. They have everyone has interactions with different groups of people. You may have interactions with coworkers, teachers, students, peers, friends, family members, patients, and their family members. Some of the interactions may be positive, but some may be negative. Every interaction can have an effect on the physical, mental, and emotional health of an individual. So the benefits of a good relationship is they provide a sense of belonging and self-worth, allow an individual to learn to trust and respect others and receive trust and respect in return, encourage participation in new ideas or activities, encourages personal growth, increases self-confidence, offers safety and security, improves physical health by decreasing stress, provides support during tough times, and share celebrations of good times and make life more enjoyable overall. So adverse effects of a negative relationship, it lowers your self-esteem, feelings of being powerless or worthless, creating suspicious about the sincerity of other relationships, feeling isolated from others and hesitant to participate in social activities, creating stress, developing depression and withdrawing from others, causing physical illness such as headaches, chronic pain, digestive disorders, hypertension, insomnia, sleep problems, and a weak immune system. So if you have a negative relationship, if you can at all, you want to get out of it ASAP, whether it's a boyfriend or girlfriend, or if it's just a friend. If they try to pull you away from other family and friends, if they make you feel worthless, if they are disrespectful to you, whatever the case, you want to get out of that relationship, even if they say They will be better next time, or they will improve, or they may apologize. But and then a couple days later, they're right back to being disrespectful towards you. Get out of the relationship quickly. Ways to develop good interpersonal relationships is maintain a positive attitude and learn to laugh at yourself. Be friendly and cooperate with others. Assist others when you see that they need help. Listen carefully when another person is sharing ideas or beliefs. Respect the opinions of others, even though you may not agree with them. Be open-minded and willing to compromise. Avoid criticizing others. Learn good communication skills so you can share ideas, concepts, and knowledge with others. Support and encourage others and perform your duties to the best of your ability. It's important to evaluate the relationships that you have to make sure you have positive ones in your life, and if at all possible, get rid of the negative relationships. You do not have control over what people say or do. You have to think about things you can say or do to protect and care for yourself. Maximize positive relationships and minimize the negative ones by avoiding the people who create them as much as possible. Individuals who have a network of positive relationships are healthier, have lower blood pressure, experience less anxiety, manage stress and conflict more appropriately, they heal faster, they have less pain or better control of pain, are less likely to be depressed or abuse substances such as drugs, alcohol, and tend to live longer, happier lives. So basically, you want to make sure you keep positive people in your life and try to get rid of those negative ones.